Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, Congress returns from a long 6-week congressional recess this month and begins work on a variety of different issues, including funding the federal government, funding for which expires on October the 1st, 2019. In the meantime, there has been a number of developments around the area of orthotics, prosthetics, and durable medical equipment. In particular, what we reported on last month was the publication of a proposed rule for durable medical equipment, O&P, or DMEPOS. This proposed rule included some significant changes to what they call the gap-filling pricing methodology for new technologies or innovations, as well as quite a significant expansion of prior authorization for both durable medical equipment and prosthetics and orthotics. Both of these are alarming developments, and the NAAOP, in conjunction with the O&P Alliance organizations, will be submitting extensive comments to this proposed regulation over the next few weeks. And keep an eye out for those comments when we publish them. We'd be happy to try to assist others in submitting comments as well, and just contact NAAOP if you'd like to do so. In addition, MedPac, the Medicare Payment Advisory Committee, has begun meeting again. They took the summer off, as they typically do each year, and have now begun a series of meetings leading up to a March report and then eventually another report in June. If you recall, a year and 3 months ago, MedPac published a report on orthotics, and there was some very illuminating materials in that report on the orthotic benefit, primarily under Medicare. Now, essentially, MedPac is picking up its work on this issue area and has begun to delve into competitive bidding, not just for orthotics, but for all of DMEPOS. In fact, the most recent meeting held just last week talked about, the commissioners talked about DMEPOS competitive bidding and the possible expansion of competitive bidding to a wider range of items and products and potentially even services under the Medicare program. There was a fairly good discussion and a wide variety of opinion. There are at least a few commissioners who understand that competitive bidding should be limited to commodities and not to customized or service-oriented types of care that are provided to Medicare beneficiaries. But there are others who talked about expanding competitive bidding to a much wider swath of benefits, including MRIs and other imaging services, including even discussion about bundling types of surgeries, cataract care, for instance, and other kinds of health care delivered by the Medicare program. So the commissioners tasked the MedPac staff with returning to them at a future meeting to further study ways of measuring the impact on beneficiaries' outcomes of competitive bidding. CMS currently asserts, and MedPac asserts, that there have been no harm, there's been no patient harm to the implementation of competitive bidding, despite the fact that competitive bidding has driven down expenditures in the DMEPOS area that have been exposed to that program by about 50% on average. For diabetic test supplies, it's something around 80%. So this program is being viewed by MedPac and by CMS as quite a successful program for reducing Medicare outlays. There's a question as to what the real impact, both short-term and long-term, competitive bidding will have on patient care. Certainly, we will continue to make arguments that competitive bidding should not apply to prosthetics, should not apply to custom fabricated or custom fit orthotics, and that to the extent that the law permits off-the-shelf orthotics to be competitively bid, we would hope that Medicare and MedPac would continue or would, in fact, put in place certain safeguards to make sure that patients don't suffer and that the benefit remains a viable one for those in need of orthotic care. So we'll continue tracking these issues. We'll most definitely report back on what MedPac recommends in the end, and we look forward to our briefing next week. Hope to see everyone in San Diego for the national meeting that AOPA will be hosting. Thanks so much.